Welcome to Occupational Health and Safety General Rules and Safety Culture Training. At the end of this training, participants will have knowledge of general occupational health and safety rules and safety culture. By the end of this training, participants will be able to understand the basic principles of occupational safety and health, understand safety culture and its benefits to the organization, and ensure the establishment and maintenance of a safety culture. According to the definition provided by the World Health Organization, health is defined as a state of complete physical, mental, and social well-being. In simpler terms, a healthy individual is not only physically well, but also mentally and socially well. Based on the definition of health, occupational health refers to the physical, mental, and social well-being of workers in their workplace. Occupational health has a wide range of effects because it affects everyone who interacts with workers. Various definitions of occupational safety can be found in the literature. First, when looking at the concept of safety, if something is not harmful or risky, it can be said to be safe. But this is not an achievable state. Instead, safety should be perceived as a value judgment. If the risk of injury in a machine or action is considered acceptable, then that machine and action should be considered safe. Hazard refers to the potential for harm or damage to exposed individuals, the workplace, or the environment, arising from physical defects in the work environment or from human error, or from external sources whose scope is not yet defined. Incident is a situation that, despite being an accident in terms of its occurrence, does not result in injury, damage, or harm. Accident is a situation resulting from an unplanned and unexpected event that causes injury or damage. Work accident is an unwanted event resulting from the combination of hazardous conditions and hazardous behavior during the performance and execution of work, occurring under specific time and place conditions and causing death, illness, injury, damage, or loss. Risk can be defined as the combination of the likelihood of an event occurring at the workplace that could cause harm or damage to exposed individuals or the work environment, and the severity of such harm or damage. Acceptable risk refers to the level of risk that an organization can tolerate, taking into account legal requirements and its own occupational health and safety policies and practices. Health means not merely the absence of disease or infirmity, but a state of complete physical, mental, and social well-being according to World Health Organization. Occupational diseases are a group of diseases where a cause and effect relationship can be established between harmful factors and the human body, resulting from work-specific causes according to World Health Organization. When accidents are examined, it becomes clear that they occur as a result of 5 basic factors occurring in sequence. These 5 fundamental factors are referred to as the accident chain. Without one of these factors, the next cannot occur, and without the entire chain being complete, there is no accident or injury. Occupational safety science adopts the 2 factors that form the third link in the accident chain, dangerous actions and dangerous conditions, as its primary area of focus in accident prevention efforts. The combination of dangerous actions and dangerous conditions, which form the third link in the accident chain, is the weakest link in the chain. Therefore, the first task of occupational safety officials is to identify dangerous behavior and dangerous conditions and take the necessary steps to eliminate them. 88% of workplace accidents are caused by dangerous behavior, 10% by dangerous situations, and 2% by unavoidable and unknown factors. Hazardous behaviors are unsafe work practices, unnecessary speeding, rendering safety equipment inoperable, using tools and machinery in a dangerous manner, unsafe loading, transporting, and stacking, unsafe positioning, working in hazardous areas, panicking, joking around, or being careless, failure to use personal protective equipment. Causes of hazardous behavior: personal flaws or limitations inherent in the worker's nature or acquired later: carelessness, recklessness, indifference, poor judgment, lack of foresight, etc. Lack of knowledge and skills, physical and mental unsuitability for the job, unsuitable mechanical conditions and physical environment that encourage such behaviors. As can be seen, the individual employee/employer first creates unsafe/unhealthy conditions, which then contribute to accidents or occupational diseases. A detailed classification of the causes of hazardous movements and the implementation of measures to address them are of great importance for accident prevention. Hazardous conditions: inadequate machine guards, working without guards, use of defective tools, machinery, or equipment, unsafe design of tools and machinery, insufficient or poorly maintained buildings, tools, and machinery, insufficient or excessive lighting, insufficient ventilation, working with unsafe methods. The elimination of hazardous conditions is the responsibility of employers. Elimination of hazardous situations: engineering and revision, identification of hazards, assessment of risks arising from hazards, identifying control measures to prevent or reduce risks, implementation of control measures, continuous monitoring of the implementation of control measures. B. Persuasion and motivation education, education and training activities, organization of various competitions, warning signs and posters, awareness raising, sensitization, rewards/incentives. C. Ergonomics, determining the appropriate employee for the job, developing machinery, facilities, and tools according to the biological characteristics and abilities of employees, improving posture and movements during work, etc., and other requirements of ergonomics. D. Disciplinary rules. The application of disciplinary measures and sanctions should be the last resort in ensuring workplace safety, but must be considered when no other options are available. This principle shows that the causes of incidents referred to as near misses must be thoroughly investigated and eliminated. An important feature of the 129-300 rule is that it enables the prediction of potential accidents in a workplace. In workplaces where workplace accident statistics are compiled, the accident frequency and accident severity ratios obtained in previous years provide the opportunity to make predictions for the following year. We must understand that the fundamental purpose of occupational health and safety efforts is to prevent workplace accidents and occupational diseases before they occur, thereby safeguarding the right to life. To achieve this, it is necessary to draw attention to the importance of integrating the three elements of occupational health and safety, namely people, management systems, and technology, with preventive occupational health and safety, hiring the right people, and procurement and engineering. It should be understood that companies as human resources departments, together with top management, should be the pioneers and driving force in adopting occupational health and safety as a culture within organizations. It must never be forgotten that a genuine and successful OHS culture is an indispensable condition for achieving the goal of zero workplace accidents and occupational diseases. As a concept, it was first used in a report prepared after the nuclear accident in Chernobyl in 1986. This report pointed out that significant design flaws, organizational errors, and employee violations played an important role in the Chernobyl accident. Both in the Chernobyl accident and in other major accidents, safety culture has been a key concept in explaining the role of the human factor in ensuring safety, especially in situations where the level of risk was higher. According to Maslow, human needs start at the bottom of the hierarchy. As a need is sufficiently satisfied, people move up the hierarchy, and once a need is satisfied, it no longer influences human behavior. Maslow's hierarchy of needs: physiological needs, safety needs, love and belonging, esteem needs, self-actualization needs. The role of the state. The most important activity should be to regulate the necessary conditions and standards through legislation, ensure auditing, and ensure that they are adopted as state policy. Prevention of informal employment, elimination of child labor, elimination of gender discrimination, supporting Social Security, preventing income inequality, determining a livable minimum wage, ensuring that every employee has access to occupational safety and health services, regardless of the number of employees at the workplace, regulation of public health services, establishing a reliable record-keeping system, employment of an occupational physician and occupational safety specialist, conducting a scientific analysis of workplace accidents, establishment/expansion of occupational health institutes, protection of workers in legislation, promoting safety awareness in society, facilitating social dialogue among stakeholders related to occupational safety and health employers, workers, etc. Providing education and consulting services on the OSH system in society and businesses. The role of employers. In the production process, adopting a people-first approach rather than a productivity-first approach, adopting a risk assessment and risk management approach, ensuring that every employee, regardless of the number of workers at the workplace, has access to occupational safety and health services, supporting workplace health and safety units, organization of first aid and emergency services, training of employees, ensuring data flow, scientific analysis of workplace accidents, taking all necessary measures to ensure that workers use protective equipment properly, ensuring compliance with technical developments, prioritizing collective and personal protective measures, providing workers with appropriate instructions, ensuring that workers are informed and their opinions are taken into account. Employers cannot achieve success in occupational health and safety if they only carry out occupational health activities to fulfill their legal obligations. It should be remembered that OHS activities are an investment in quality. Role of employees/unions, knowledge of the workplace, industry, and production process, participation in risk assessment and risk management processes, scientific analysis of workplace accidents, activities aimed at making occupational safety a priority in life, proper use of personal protective equipment, employees' responsibilities as defined by laws and regulations, to comply with all measures taken by the employer and follow instructions. Use machinery, equipment, and tools correctly. Reporting any adverse situations related to occupational health and safety at the workplace to the employer. Cooperating with the employer, health and safety representative, and other employees on occupational health and safety and avoiding unsafe situations. Participate in occupational health and safety training programs organized at the workplace to establish a healthy and safe working environment. The role of universities. Providing scientific contributions to ISIG and social policies, providing scientific infrastructure for the establishment of a reliable recording system, scientific analysis of work accidents, basic training for human resources working in the field of occupational safety and health, contributing to the postgraduate continuing education of human resources working in the field of OSH, establishing research laboratories and an academic environment related to OSH. The role of professional organizations, contribution to OSH and social policies, contributing to the training and employment of human resources working in the field of OSH, organization of post-graduation continuous education for human resources working in the field of OSH, contributing to the scientific analysis of workplace accidents. Security culture, being able to sense danger before it occurs, identifying, knowing, and learning the hazards and risks of the work being performed, staying away from hazards and hazardous behavior, avoiding unnecessary risks, transforming safe living into a way of life, internalizing and promoting safe behavior. Characteristics of safety culture, values shared by all employees. Not limited to management and audit systems, but relevant to all safety issues. Safety culture requires the participation of all employees. It influences the behavior of all employees at work. It reflects a willingness to learn and improve from incidents, accidents, and mistakes within an organization. All employees are willing to participate in safety-related activities. Participation in safety-related activities is encouraged. There is open communication on safety-related issues. In such cases, there is no fear of reprimand or disciplinary action. Safety-related incidents are viewed as an opportunity to identify system failures and make necessary corrections in the system. Training programs provide employees with the necessary knowledge, skills, and abilities to ensure safety in their work. All employees understand the potential hazards of their work and assess them appropriately. Employees do not take unnecessary risks. Managers do not cause employees to take unnecessary risks, whether intentionally or unintentionally. In safety matters, regular behavior-based feedback is seen as a way of life. There is a corrective feedback system. There is a supportive work environment where coworkers provide support for safety. All work activities and management are focused on eliminating hazards and preventing injuries. Although there are many definitions of safety climate, the most widely accepted definition is the perception of employees in the workplace regarding occupational safety. There are various factors that influence occupational health and safety perception in a workplace. These factors have been classified under various dimensions. Safety communication, aimed at determining the level of internal communication regarding occupational health and safety. It consists of statements such as there is effective communication regarding occupational health and safety issues in my workplace. Safety management consists of statements such as there is a continuous improvement process in occupational health and safety in the company. The training provided on occupational health and safety in the company is not sufficient, and management makes sufficient efforts to prevent work accidents. In general, it includes the elements necessary to establish an occupational health and safety management system. Individual responsibility. The extent to which individuals feel responsible for their own health and safety and that of other employees. Safety standards and targets. A scale consisting of statements such as the company has developed performance standards for occupational health and safety defines safety standards and targets, which are important factors for occupational health and safety perception. It includes rules that must be followed to protect the health and safety of employees. Personal participation measures employees' compliance with safety procedures and their participation in improving safety-related working conditions. Management commitment. Management plays an important role in ensuring a positive perception of occupational health and safety. Top management expresses its responsibility for taking health and safety measures. Fatalism. This assesses employees' fatalistic beliefs regarding workplace accidents. Examples include statements such as, "No matter what I do, I cannot prevent accidents from happening." There are two key points regarding safety culture. First, it cannot be said that a workplace has a safety culture or does not have a safety culture. Workplaces develop safety culture over time, passing through different stages of development. The second key point is that although safety culture is not a visible part of the workplace, it manifests itself in every aspect of the work performed. Traditionally, organizational culture is determined using qualitative methods such as observations and interviews. Psychological, situational, and behavioral dimensions can be measured using a combination of qualitative and quantitative methods. Although many methods have been used to measure safety culture and safety climate, there is still no standardized method ready for use in different fields or in a single field. Accident rates are widely used in measuring safety performance because they provide readily available information and are easy to understand and analyze. A negative safety culture refers to a culture in which people do not perceive existing risks as risks, or even if they do not take them seriously or dismiss them or exhibit excessive self-confidence in the face of risks. The characteristics of organizations with a negative weak or negative safety culture can be summarized as follows. Even if people say safety comes first, workplace safety is sacrificed for other objectives. Therefore, theory or policy does not align with practice. Similar operational errors continue to recur. Workers' interest in occupational safety is not consistent. Lessons are not learned from past incidents. Although statements about the safety situation indicate that everything is safe, employees believe that something could happen at any moment. It is believed that work safety is someone else's responsibility. Management and supervisors/engineers do not share the same beliefs about safety and exhibit conflicting behavior. It does not give the impression that occupational safety is addressed consistently and effectively throughout the organization. There is a state of indifference and disregard for risks among employees. The investigation process for incidents is designed without coordination with workers. In operational error investigations, workers are personally blamed. As a result, the underlying causes of problems cannot be identified. A culture of blame is prevalent. Sustainable research practices cannot be implemented. Employees are overly confident about occupational safety. Reducing the risk of employees being exposed to workplace accidents, implementing it at all levels of the organization, and establishing a set of policies, procedures, and practices related to accident and illness prevention. A positive safety culture creates a work atmosphere where employees avoid unsafe actions. A positive safety culture is characterized by communication based on mutual trust, shared perceptions of the importance of workplace safety, and confidence in the effectiveness of preventive measures. A positive safety culture encourages individuals to be mindful of negative outcomes and to act with care. From a business perspective, developing and maintaining a positive safety culture is an effective tool for improving an organization's occupational health and safety management. Occupational health and safety are accepted as priorities. People share accurate perceptions of risks and adopt the same positive attitudes toward occupational health and safety. Everyone in such an organization is aware that compromising on occupational health and safety during work is not expected of them. All employees genuinely believe in occupational safety and know what their role is in this regard. There is mutual trust between supervisors and management. Management and supervisors share the same beliefs regarding occupational safety and behave in a coordinated manner accordingly. Everyone in the company can freely discuss workplace safety risks and improvements with people outside the company. Those who report incidents are not punished. On the contrary, they are encouraged to do so. Both management and supervisors, as well as other employees, believe that people can make mistakes and that reporting mistakes and incidents is a fundamental requirement for learning and improving work safety. The issues reported are taken into consideration by management and evaluated together with those concerned. Investigations into errors that occur during the work carried out are aimed at identifying the sources of the problem, preventing the recurrence of errors, and determining who is responsible on this regard. Occupational safety is frequently discussed at all levels of the organization and is the first item on the agenda of the Board of Directors' weekly meetings. Employees receive high-quality training, including occupational health and safety training. A good working environment is provided for employees. The workforce is stable and experienced, and employee job satisfaction is high. The company maintains a strong stance against external pressures. Businesses are less prone to workplace accidents. Ensuring that safety culture is perceived throughout the organization is not possible through unilateral efforts. The management must instill safety culture as a value within the organization, which depends on the commitment of both management and employees. Creating occupational safety in an organization can be achieved through a management team that supports occupational safety and employees who participate actively. Regardless of the circumstances, management in all organizations must view occupational safety culture as an integral part of the work being done and reflect this to employees. No matter how willing and eager the state, businesses, and unions are to fulfill their responsibilities regarding worker health and safety, if these efforts are not adopted and supported by workers, the desired results cannot be achieved. Therefore, workers must also comply with the rules, strive to benefit as much as possible from training activities, and participate in training programs with the understanding that these efforts are ultimately in their own best interest. Establishing a safety culture and occupational safety and health policies pursued by companies is important in many respects. Efforts should be made to establish an effective occupational safety and health management system first at the national level and then at the level of each enterprise. New projects related to occupational safety management culture visions should be developed through international cooperation and collaboration. Along with developments in technology and industry, poor working conditions threaten occupational safety and health, as well as public health. Subjecting workplaces to intensive audits, increasing the importance given to training, conducting medical checks, utilizing the necessary ancillary sciences to reduce occupational accidents and diseases, and creating ergonomic working environments in workplaces will be beneficial.